Hello everyone, my name is Dr. Marty Kotler, and I'm the president of Target Coding. Thank you for listening to this coding, compliance, and documentation presentation. Today's topic is massage therapy. Now, massage therapy is a very common procedure provided in thousands of chiropractic offices nationwide. And there just seems to be a natural fit for chiropractors and massage therapists working together. You know, there are other services that work very well with chiropractic like nutrition and acupuncture, but I think massage therapy is one of the most popular adjunctive procedures in chiropractic practices nationwide. Just seems to be a real good relationship between chiropractors and massage therapists. Now, there are two ways in which massage therapy services can be incorporated into your practice. First, as a cash-based practice, a non-insurance-based service, and the second is as a medically necessary insurance reimbursable service. So there are two ways in which you can include massage. So let's go over the insurance reimbursable chiropractically or medically necessary scenario first. And this is all going to begin with the patient's history. Now, you know what, even before the history, if you have a good quality health history intake questionnaire, there's typically an area for the patient to write, the reason for today's visit or the chief complaint. What is the patient writing in that area? Hopefully they're writing neck stiffness or back pain and back stiffness or restricted motion. See, that's what I call setting the table or creating a breadcrumb trail. That first breadcrumb that you're dropping down is what the patient writes on the health history form. Next, you're going to do a history. You're going to ask the patient questions. So, what did the patient tell you? What did the patient say is wrong? Now, in a typical chiropractic practice, most patients come in with neck pain and back pain and low back stiffness. So that's going to be in line, so to speak, with recommending massage therapy. Again, this breadcrumb trail that it all has to fit, what the patient writes down, what they tell you. If the patient says, I have stiffness and back pain, well, massage therapy works with that. Massage therapy is used for reducing stiffness. I'm going to give you the formal definition of massage therapy in a few minutes. So after the history is done, then the next step is the exam. That's the next little breadcrumb you're going to drop down. So what do your exam findings show? You should have examination findings that show abnormal muscle function or stiffness, restricted motion when you do a range of motion evaluation. You may find edema, spasm. Do some muscle tests, palpate for tenderness. How about observing the patient getting on and off the table? Maybe you want to do some ortho-neuro tests. Use outcome measurement forms. How about x-rays? If your x-rays show some osteoarthritis, that's also a sign that massage therapy is going to be indicated because osteoarthritis typically causes stiffness and restricted motion. The next item on your list should be coming up with a diagnosis. And you should use diagnosis codes that support the use of massage therapy. There are certain ICD-9 codes that link or combine with massage. So if you're billing for massage, you should know about these certain diagnosis codes. If you'd like information about this list of approved diagnosis codes that link or combine with massage therapy, let us know. Contact us. Now, if you're a member of Target Coding, you did receive this list of codes when you first signed up. If you need them sent to you again, just let us know. So those are a few of the basics, the minimum things that you should be putting together as far as proving that the care is necessary. Now let's start talking about the code. The CPT code for massage therapy is 97124. Now, massage therapy is considered a therapeutic procedure. This is a manner of effecting change through the application of clinical skills and/or services that attempt to improve function. You are required to have direct one-on-one patient contact. Massage therapy is a timed code. In order to bill for 1 unit of massage therapy, you need to perform the massage anywhere from a minimum of 8 minutes up to 22 minutes. If you're going to bill for 2 units of massage, well then you have to provide 23 to 37 minutes of the procedure. 38 to 52 minutes is 3 units. 53 to 67 minutes is considered 4 units. So we have a range of minutes that equate to certain units. Please be aware of that. Now, massage therapy should be used as a preparatory procedure on the same day as another therapeutic procedure in order to restore muscle function and reduce edema. And, I'm going to be giving you a few items, a few key buzzwords right now that you should be including in your SOAP notes. Sprinkle these terms throughout your SOAP notes and in your exams, your treatment plan, your re-exams. Items such as improving joint motion, decreasing pain. Massage therapy is used to restore muscle function, reduce edema, decrease spasm, increase circulation, and promote tissue relaxation to the muscles. So these are what I consider it's the clinical rationale. These are the documentation suggestions. They're really important. I'm going to repeat them. Maybe you want to write these down. So massage therapy should be used to restore normal muscle function, reduce edema, improve joint motion, decrease pain, reduce spasm, increase circulation, and promote tissue relaxation to the muscles. It should be related to other therapeutic procedures within the overall plan of treatment. Now let's talk a little bit about Modifier 59 and the CCI edits on massage and chiropractic adjustments. You should be aware that the National Correct Coding Initiative, or the CCI edits, as some people call them, and these were created by CMS, and these state that the massage should be performed in a separate site than the chiropractic adjustment or the chiropractic manipulation. However, the AMA, the American Medical Association, they took a different approach, and this was really good for us as a chiropractic profession. This is a very positive approach that the AMA took that has helped the chiropractic profession, and the AMA stated that the massage therapy can be performed in the same region as the adjustment. So that's really good to know. Now, even though the AMA says that the massage can be performed in the same anatomic site as the chiropractic manipulation, I still recommend you use the 5-9 modifier. And make sure you know the reason why you're using the 5-9 modifier, and for that matter, all the modifiers you use. Like, I've spoken to a lot of doctors, and I've said, I've asked them, why do you use the 5-9 modifier? And I'll hear things like this: well, I heard that's how you can get paid, or I bought a practice from a chiropractor that was using the 5-9 modifier, so now I'm just using it. Those are not the best answers. You should know the clinical rationale and the reason for all the modifiers that you're using. You should know the definition of the modifier. So the 59 modifier is a separate and distinct procedure. And that's what you're doing. Now, the other way to incorporate massage therapy is on a cash basis, like a spa-type massage. There's a very popular franchise right now. It's called Massage Envy. When people go to Massage Envy, they're not expecting their insurance to reimburse for a massage. These are spa-type massages. I consider this a not chiropractically necessary or non-medically necessary service. This is not insurance reimbursable. So you may perform the massage, but you know what? Sometimes the patients, after getting massages and they're paying you cash, they might say, well, can you give me a receipt? Can you give me a form? Can you give me something to submit to insurance? Well, you should try your best to not have to do that. But if you are required, the patient is demanding something, then you may need to print out a CMS 1500 form. And I would recommend you use a very simple diagnosis like muscle spasm. 728.85 is the ICD-9 code for muscle spasm. You know, that's if it's clinically applicable. And a procedure code, I would recommend something like S8990, which is a physical therapy service performed for maintenance care rather than restoration. Remember, the patient paid you cash. You've considered this a wellness service. You don't want to be reimbursed by insurance. So if you have any additional information on that approach, send an email to info@targetcoding.com. Sometimes you need to create a letter of medical necessity for massage in order to get paid. We can supply you with a sample if you'd like. So on your screen or after this presentation is over, you may see a share button or a little envelope that you can click on, and just send an email to info@targetcoding.com if you'd like information about that letter of medical necessity or more information about that approved list of diagnosis codes. And, you know, there are other things that you may want to know, like what's the difference between massage therapy and manual therapy? Manual therapy, like myofascial release, that's CPT code 97140. What's the difference between those two? You might have questions on that. You might have questions on should the massage therapist be an employee or an independent contractor? What specific information should be in the SOAP notes? So please feel free to contact us. Send an email to info@targetcoding.com if you'd like more information on that. And here's our contact information. Website is targetcoding.com. The telephone number is 1-800-270-7044. We offer membership services, online trainings, DVDs, guidebooks, webinars, seminars. Here's a little information about our program. We have a membership program. It's, you become a member of the Target Coding Coders Club. The basic membership is only $99 a month. It includes unlimited question and answer support. You'll get your questions answered within 24 to 48 hours, monthly front desk CA trainings, weekly live and recorded webinars on billing and compliance. You'll get our 2 best-selling guidebooks on the best CPT and ICD-9 codes to maximize reimbursements. You'll get updates and coding alerts throughout the year. Some of you will qualify for up to 10 online continuing education credits. And you can do a 30-day free trial of this program if you'd like. After 30 days, you don't want to continue, that's fine. Again, it's only $99 to become a member. And again, here's our contact information. Again, the email is info@targetcoding.com. The website is targetcoding.com. The telephone number is 1-800-270-7044. So I want to thank you again for attending this presentation on massage therapy. I hope you learned a lot. Take care. Bye-bye.